Hi everyone, I'm Danita Cohen, the Chief Experience Officer at UMC. Welcome to Ask the Medical Experts, and today I am joined again by Dr. Luis Medina Garcia, our infectious disease physician at UMC. Thank you so much for joining us again.
Pleasure to be here as always.
Thank you. And we've been here, since February and March, always thinking we were going to round that corner. Not yet, right? We're still in the thick of it.
Yeah, so it's been a long ride, and I think we're better off by a long shot as opposed to the beginning of the pandemic in regards of PPE, how hospitals have managed the surge of patients. Now we have readily available treatments such as remdesivir that we didn't have at the beginning. So we've come a long way, but we are facing other challenges as time goes by. So we wanted those cases to come down near zero, and with things reopening and people being fatigued from all the measures from staying at home, we are seeing a rise in the cases in Southern Nevada. So,
is the patient population different now than the patients you were seeing when this all began?
A little bit. So at the beginning of the pandemic, the concern was obviously for the elderly folk to be isolated more so than the younger people, because there was that issue of higher mortality with them, and they did an excellent job with that. And now we're seeing the vast majority of cases in younger persons, so 40 and below. So that's a difference in the trend of cases that are reported. But, we have to continue the efforts.
Do you think that speaks to the fact that maybe older folks are listening more to the experts and staying home and taking the precautions, and younger folks are not, perhaps?
Well, I think that's part of it. But if you're retired and have a steady income source, then having to go out there to make a living is probably a little less of a concern.
Right.
So you have the luxury of being able to stay home. And the younger you are, especially if you have a family, then you run into that problem of having to provide for them. And you do what you think you have to do to keep your family afloat. But, that doesn't mean that you should be any less careful by always wearing your mask, washing your hands, keeping safe distance, etc.
Are you seeing that patients are less sick or less critically ill than they were at first?
So, not really. I wouldn't say that they have a milder illness. They just present sooner. At the beginning, we were telling people, please stay at home, because we didn't have the hospital capacity to take care of them. And that has markedly improved. So pretty much any hospital has the ability to take care of everyone. So we're seeing a lot more wider range of disease presentation. People that would come in before, they need oxygen, as opposed to previously when we told them, look, please don't come until you really feel that something's going wrong. So we're seeing a wider gamut of disease presentations. And you see a lot of them that haven't gotten as sick. And that's good, because now we have treatments to give them that hopefully prevent them from getting any sicker. Length of stay in the hospitals has come down, which is also a good marker. And overall care is better.
What advice would you give for somebody who has tested positive? When should they go to a quick care, go to the emergency department?
It's easy to forget that things can get out of hand fairly quickly. And so we have to make a conscious effort of monitoring yourself. And I think the fever is something that people can feel readily, but the shortness of breath, the difficulty breathing, is probably the most important thing to look after. If you feel that you get winded very easily by things that you normally would tolerate, such as going from the couch to the kitchen to drink some water, or from your bed to the toilet, and you feel that you have to catch your breath, then you should definitely come see a doctor. And ultimately, I tell people, if you feel that something is really wrong with you, it's better for you to go seek medical care. We're prepared to take care of you, assess your needs, and treat you accordingly. I'd rather that you come early and not wait until it's too late.
You would rather send somebody home, right?
Absolutely.
In all cases, yeah. When should somebody get tested, and has that changed over the last couple of months?
So it's changed in the sense that you have widely available testing. So at the beginning of the pandemic, we tried to identify patients that had a higher likelihood of having the disease. So we would ask for symptoms that were consistent with it, like fever and the cough and the shortness of breath, at the beginning the travel history and such. But now we're trying to test anybody that could have gotten the infection. So if you were known to be exposed to somebody who had COVID, it's a good idea for you to be tested. The timing of that test is under controversy, but generally speaking, 5 to 7 days after the date of the exposure is probably the sweet spot when your test would be positive if you picked up the infection. So patients that have shortness of breath or fever or loss of the sense of smell and taste, those are things that could be suspicious for a mild COVID infection. That's a good reason to go get tested. And if you're not feeling well with a respiratory illness, just go get tested. So now the influenza season is about to get started, and that'll present a challenge to try to differentiate whether your illness is from influenza or from COVID. They do have different symptoms, but it's difficult to make that clinical determination. So even your doctor won't be able to tell whether your symptoms are due from COVID or from influenza. So testing really becomes key. And there's testing available everywhere through UMC, through the county. So you sign up, schedule the test. The process is very efficient. You're out of there in almost no time.
What about the efficacy of the different tests that are on the market? There's, the really quick tests, and then the difference between, the self-swabbing and having a clinician swab. What's the difference between all those?
So you have 3 main types of tests. You have molecular tests that look for the genetic material of the virus. That's what we currently consider the standard of care. And that's usually done by a swab, either in the nose or in the mouth. And we offer that through UMC in our testing sites. That's probably the best type of testing that you should get. And the turnaround time for those tests at our facilities is around 12 to 18 hours. It's reported through your cell phone, through our UMC Connect app. And if it's positive, you also get a text message followed up by health department call and, the whole protocols of safety that we have. Other companies also offer molecular testing, like private labs. The next category of testing is antigen testing. And that usually is a point of care test, meaning you have the sample taken and the test is run at that same place as opposed to sending it to a lab. And antigen testing is a little bit less sensitive, meaning it has a lower ability of detecting patients with the disease. But it has a very good sensitivity, so you have a very low rate of false positives, meaning if that antigen test is positive, it's pretty much positive. Yeah. And so I recommend antigen testing less, especially if you have symptoms of COVID, because then you have that possibility of having a false negative test that can give you false reassurance. But if the antigen test is positive, you could take that to the bank for the most part.
Take it home with you.
Right.
With your mask on.
That's right.
Yes.
You keep your mask on. And,
Yes.
and again, testing is a critical part of this, but it is no replacement for dropping the efforts on the other containment techniques like mask wearing, social distancing, and such. And then the third type of tests that people do are antibody testing. And I leave that at the last because we need to remember that this is not diagnostic testing for acute infection. When you have developed antibodies against COVID, that means that you're probably entering the recovery phase. You may still be infectious, but it kind of catches people on the tail end of the disease, people that are hopefully no longer infectious by then. And so there's so many different companies making all these types of different testing that it's really hard to keep track of it. The FDA has a website where they list all tests that have received EUA, which is the emergency use authorization. But it's very difficult for people just to go in there and look up the test that they're going to be getting. A lot of the time, you don't know which one you're going to get. You just know which category. So go to a reputable lab, go to a main lab to get your test done. And then they should all have instructions given to you about what to do before the test is resulted for you. So if you're feeling ill, continue to isolate at home, continue wearing masks. until you get the results of your test. If you're asymptomatic, you should still continue to wear a mask so that you don't get it, so that we don't drop the ball on the efforts to prevent the spread, which is the main idea.
The antibody test, does it show, if you come up with antibodies, does that mean you had it? Or does that mean your body was predisposed that if it was in the air, you wouldn't get it?
So when you measure antibodies, you're measuring the body's memory against a specific infection. So in this context, a positive antibody for COVID means that you have had COVID and that your body has now recognized it. Hopefully you're recovering from it. And that's what it tells us. I think the important thing to mention is traditionally in other diseases, if you have antibodies against a particular disease, or infectious disease of course, you're looking for protection, so immunity from it. And there's still a lot of controversy in that. For what we know at present, patients do seem to form antibodies against COVID, and for the most part, the antibodies are protective, meaning it should prevent you from getting the infection again. We just don't know how long that protection is going to last. So most recently there was a paper saying that it was anywhere between 3 and 6 months of protection. And so it helps to clarify some things. If you had a syndrome or a disease like COVID, but you tested negative on the PCR and you tested positive on the antibodies, it kind of tells us that yes, it was COVID, what you had. And it could offer some information towards you having a degree of protection because you recover from the disease. We just don't know how long that's going to last.
How many people have you heard of getting it twice, 3 times?
Very, very few cases. One of the first reported cases in the United States was in Nevada, up in Reno. Dr. Pandori's lab reported that and published it. Very minute differences in the virus the second time around, so there's a slightly different viral sequence on the specialized testing, and they couldn't have detected that in many major labs. I mean, they had very specialized testing where they were able to sequence out the whole virus genome to tell that it was slightly different. But across the world, cases of reinfection have been documented. For the most part, the second time around, patients haven't gotten as sick as the first time, but there's still so much that is unknown that you still want to make every effort not to get it the first time, and certainly not to get it again.
Right. We've heard a lot about, some people have said if they have it or had it, that they're immune to it and that they can't carry it. What do you make of that? Can they still infect other people around them after the 2 weeks or so, past symptoms?
So for the longest period of time, there was not a lot of data that would tell us what the truth to that answer was. And thus far, with everything that we know about it, the longest described period of infectiousness, meaning that you become sick and even after your symptoms have resolved that you could still infect others, is about 20 days. But that's like the outlier, meaning most people stop being infectious after 10 days. A very few amount of people, especially those that are immunosuppressed, like transplant patients or patients under chemotherapy, can be infectious for longer periods of time, but it hasn't been described past the 20-day mark. So that's why CDC has recommended that if you're otherwise healthy and you unfortunately get COVID, that you are to remain in isolation for 10 days and at least 24 hours without a fever before you're able to come back out into the community.
And any reason to retest at that point?
So, not really. So, and the reason behind that is the tests are not a marker for continued infectiousness. The tests don't tell us if you're still infectious now. They just tell us that the illness that you had was due to COVID because we were able to detect the virus there. But after you recovered, that test that we check cannot tell whether you're still infectious to others. That's why you have to go with a time-based strategy for stopping isolation, which is the 10 days, or if you're immunosuppressed or were critically ill from the disease, then you go 20 days. So there is no test available right now that tells us whether you're still infectious outside of viral culture, but that's not available pretty much anywhere other than high-level labs. But for the most part, it's really unnecessary because we have enough data to know that after 10 days, a good 90% plus of people are no longer infectious. Then that's just, you make blanket recommendations based on that. And that's consistent with CDC and WHO recommendations.
What about the folks that we hear who've recovered from COVID, but they have what's called LongHaulers disease or LongHaulers, and they still feel some symptoms? Maybe they still feel that tightness in their chest, or they feel muscle aches, or have you heard a lot about that? Is that happening to a lot of people?
Absolutely. It's really unfortunate. We know that they're no longer infectious based on what we just talked about. And it seems to be sequelae from high degree of inflammation from the body. And the symptoms that people experience, unfortunately, have many different organ systems involved. So some patients can just feel fatigued. Other people just feel short of breath. Other people get chest pain. So COVID has been known to affect all organ systems. So primarily it's a respiratory disease. So probably the most common symptom to lag is the shortness of breath. But if you have heart involvement with COVID, that could give you also shortness of breath or chest pain. Some patients have developed heart failure. So it's really a complex disease, and it's capricious in many ways, which is why really we're trying to focus heavily on the people not getting it. And that's with the social isolation, mask, social distancing, but also upcoming therapies like monoclonal antibodies and vaccination, of course. So the idea is if you are vaccinated, you have some degree of protection from the vaccine, plus the social measures and the mask wearing and such decrease your chances of getting it. And then if you unfortunately do get it anyway, then you'll have treatment that help you get better quicker.
So we've talked about the importance of wearing a mask, but we've all been out and we have seen the face shields that are really very open on the side and on the bottom. Is that offering any protection at all?
Not good enough. So I see that a lot out in the public, and they're fashionable and it looks good, but it just doesn't protect the person that wears it and doesn't certainly protect any of us around them. And they've formally studied this with different types of face coverings. And if you just think about it, if these droplets are so small, they have no problem going around the mask. So if you look at your mask, it's pinned in near your nose. You do have a little bit of air coming out the sides of it. The bottom part is pretty closed. And with face shields, it's easier to breathe, obviously, but it only protects you from direct droplets, like literally spit going towards you. But it doesn't protect you from airborne particles. So it's definitely not a primary way of protecting yourself or others. It's just another added layer of protection. It's good for protecting your eyes, but it doesn't really protect you the way a mask does.
And obviously when people are wearing a mask, it has to be over their nose, right?
Yes, nose and mouth, because, shocker, nose is connected to the mouth. It is, anatomically.
Oh, you learned that in medical school,
That's right?
First year.
Right. So face shields, unfortunately, are not good enough.
So given all that we have just talked about in the last 20 or so minutes, and the fact that, some folks have lingering and very serious health issues, it has to frustrate you that you see folks being complacent, gathering too much, not wearing their masks, not hand sanitizing, just feeling like it's going to go away. That has to frustrate you.
And as a clinician, it's terribly difficult because you think of the sacrifices that we make personally as physicians, putting our families at risk as well in treating patients. But I also understand the human aspect of it. And psychologically, it's extremely taxing for people to maintain all these strict measures all the time. But if you make it a part of your everyday life and you stop fighting it, it just becomes second nature. Just like we don't go outside with inappropriate clothing.
You remember to get dressed, right?
You get your mask. If you leave your house, think of your mask as an American Express. Don't leave home without it.
There you go. Don't
and
leave
then
home
wear
without it.
Because it protects you, it protects those you love, and it helps us get through this faster. It's buying us time.
What have you learned, and what are you reading about a vaccine? Are we closer to a vaccine now? Is it on the forefront, or are we still a little bit away from that?
We're much, much closer. And so never in the history of medicine had vaccine development been so fast as with coronavirus. And that's multifactorial. First, you had 20 years of research on SARS-CoV-1 on which you started building upon. And then the government has made every effort to remove the red tape for things to go forward. That doesn't mean that they're advancing these studies with any less care. You still have to meet all the safety and efficacy guidelines. And then, the government has secured financially the development of these vaccines, so it really helps to fuel the progress of it. In the United States, the Moderna vaccine, which is new technology, seems to be very effective. There have been no major side effects reported. There's two other large vaccine groups that are working on adenovirus vaccines. It's just using another virus to help you get immunity to this virus. And those have had a couple of patients had side effects, so they stopped the trial to make sure that it was safe to continue the research. But I think, like Dr. Fauci suggests, he's cautiously optimistic that in the next few months we'll have a viable vaccine that's safe and effective, and that we can start dispensing to the appropriate populations first, and making headway, and hopefully making this pandemic controlled sooner rather than later. But it really takes everybody's effort.
So for those folks who say it's not going to be safe, I'm afraid of it, I don't want to get in line, obviously from what you just said, every precaution is still being taken. We're just taking away the government red tape and the files sitting on the desks at this point.
In addition, because the pharmaceutical companies know that there's distrust in the process, they've all gotten together and signed essentially a pact saying that they promise to not look for approval for a vaccine that has not met the safety and efficacy marks in the first place. So that they can't say, it's an administration issue, that they just gave us a green light to proceed for political purposes. So the FDA remains committed, the CDC is committed, and even the pharmaceutical companies are committed to not suggest approval for a product that's not ready for prime time.
With the holidays coming up, what advice do you have? Because we have all the big holidays coming up. People do want to be around their family and friends. Is it safe? And what do you recommend?
So it's not safe.
It is not safe.
We want it to be safe.
Yeah.
But rationalizing, unfortunately, doesn't help, right? One of the things that makes it difficult is if 40% of the infections, or up to 40% of the infections, can be asymptomatic or minimally symptomatic, you don't know that you have the infection, but you can still transmit it to others. The other part is, in family gatherings, we are conditioned to thinking, it's my family member, they can't hurt me, they wouldn't hurt me. And the truth is, they wouldn't want to hurt you, but they could inadvertently hurt you. And so inside homes and gatherings and food and buffet style serving, and if people sit down at the table, which is what we do to celebrate the holidays, you have to have your mask off. So you would have to devise a way for you to minimize those risks. Always wear a mask. Do an event outside if you can. Social distance. Don't have everybody sitting at the same table. Have several tables that are, several feet apart. Have one person serving the food as opposed to everybody self-serving the banquet. And really mask wearing and limiting the duration of the interaction. So if you normally have Thanksgiving for 4 hours, make it a 1 hour affair.
Eat fast. You gotta go.
And we look forward every year to being with our family and enjoying our time together. We want to make that last. As a clinician, I can't tell people, Thanksgiving is canceled or Christmas is canceled or insert holiday here. Mm-hmm. But we all protect what we love and who we love. And that's what this is about. This won't last forever. There'll be effective treatment, there'll be effective vaccines, and then we could get to business as usual. But I would tell people to be very careful. With the winter coming, people spend more time indoors, so the risk increases.
It's the worst thing to have happen, right, during COVID, is to have a big Thanksgiving dinner with your whole family in one place, eating with their masks off.
I would say
the worst.
Unfortunately, it would
Yeah.
be ill-advised.
Yeah.
But if you can't get around not doing it, then take every precaution that you can think of.
You did touch on all the testing that's available. And by the way, you can go to our website at umcsn.com and click on the COVID-19 Testing Center. We have locations all throughout the Valley. Some of them are drive-through and you can self-swab, which is extremely convenient. You can make an appointment. So come and get tested. But there's locations, as you said, throughout the Valley. So definitely no shortage of tests, right?
Yes. And if you feel sick, come in to get care. The Valley's hospitals are ready for you.
Definitely ready. And UMC is the only hospital in the Valley to test every admitted patient. So any patient who is admitted to our hospital, we test them for COVID. So thank you so much for joining us again.
You're welcome.
You are always so full of knowledge.
I want us to focus not on what you can't achieve, but what you can do. There's many things you can't control, but we should focus on the ones that we can.
And we control by wearing your masks, right?
Throw up their hands and say, oh, well, whatever happens, happens. We've lost this battle. That's
right.
Not the American way.
Yeah, absolutely not. Yeah. So wear your masks, hand sanitize, and social distance. Yes?
Outside better than indoors, and social distance.
All right. Thank you so much. Thank you for joining us. We appreciate it. Take care of yourself. Go sanitize your hands. Put your mask back on. And we'll see you next time right here on Ask the Medical Expert.